Cardiac issues are so high among African Americans, probably for a variety of reasons. One, we're dealing with socioeconomic issues, cost, access to health care, but there's also a genetic component. So what I mean by genetics is there are certain risk factors that cause cardiovascular disease that African Americans are at high risk of having. So diabetes, hypertension, high blood pressure, but other social factors, for instance, not exercising enough, poor diet, smoking, these are all things that can lead to having cardiovascular disease, but also the genetic component of family histories of cardiovascular disease, as well as high blood pressure and cholesterol. Really, it's about being in control of your own health care. So really navigating those risk factors and trying to minimize those. So even little changes can help. Things like not smoking, changing diet. If anybody's like me, I start with the protein and the carbs, and if there's any space left on the plate, add some vegetables at that point. But kind of thinking the opposite way, building your plate from the vegetables out. I'm a heart surgeon. I love doing heart surgery. But if a patient can prevent actually seeing me in the operating room, that's a bigger win than me having a successful surgery. In terms of screening for heart disease, I would say everybody should get it, but I would say probably more broader, everybody should be screened for something. So that would start with having a good primary care physician that would know at what age I get screened for this, I get screened for that. Now, in terms of heart screening, it's recommended by the American Heart Association that all people in the United States start being screened for coronary artery disease at 20 years old. So it's never too early to establish that relationship with a primary care physician. At that point, they check normal vital signs like blood pressure, heart rate, get EKGs, send labs, and then they'd really know based upon the current recommendation on what the next screening step should be for a patient. When we're dealing with heart failure, we're talking about the heart not functioning as well as it could, oftentimes how it's squeezing. So as a result, you can get fluid buildup in your body, so you can get swelling in your hands, your feet, your legs, shortness of breath because potentially fluid building up in your lungs, fatigue, even just a cough that's persistent. These are all signs of heart failure. It is at times difficult to get people in for screenings. It's not always easy to get into a physician's office, so you're dealing with time constraints, cost, access to health care, but also the idea that I don't go see a doctor until I feel poorly, so sometimes I can not even brush off, just not prioritize that well visit because everything is going well. So I think really that relationship with a primary care physician is paramount. The two main issues that I'd really like to drive home, one, establishing care with a primary care physician is absolutely important. That's how you prevent not only getting cardiovascular disease, but screening for cancers, managing risk factors, and also just to empower the patient. They have to be an active participant in their own health care, but preventative maintenance is really the key, taking those steps so you can live a long, healthy life.